How should you recover after your breast cosmetic surgery? Today we're going to talk about the how and the why. I think that knowing the why of doing something or not doing something is very important for patients' recovery. It keeps them out of trouble and gets them the best result they possibly can achieve. First off, if you've already had surgery with some other surgeon, I totally recommend that you follow their post-operative instructions. So this is meant for patients of mine who we've done a breast reshaping surgery, such as a breast lift, breast reduction, or breast implant surgery. Why is that important? Well, it's because with those surgeries, I usually am using anchoring sutures on the inside. These are internal sutures that are anchored down to muscle, and that's where these restrictions play out. That's why we have them. So for the first 2 weeks after surgery, it's no reaching or pulling with our arms. I tell people elbows right at your sides, T-Rex arms. You can lift up to about 10 pounds and that's about it. Now this is important because childcare, if your child's more than 10 pounds, which most kiddos are, especially with car seats, then we shouldn't be reaching or pulling and lifting that child. Also, for work, I recommend for most patients, take at least 1 to 2 weeks off from work. It depends on the type of surgery that you had performed. If you work from home, you can actually shave those times down a little bit before you return to work. Driving after surgery. Most patients should be fine to drive after 3 to 5 days. Again, you'll have to be off of pain medication, fully recovered from anesthesia, and feel comfortable getting very close to your steering wheel. Okay, so now we've made it to week 3 and 4. In weeks 3 and 4, we can start doing some reaching and pulling, just don't overdo it. I tell patients not to go rearrange the garage. Also in weeks 3 and 4, you can lift up to about 35 pounds. So most toddlers are easy to handle in that weight range. The only exception is if they're having a meltdown, then I don't recommend picking up that child. Now let's talk about exercise. Well, I'm a little bit more cautious on exercise. And again, this goes back to having those anchoring sutures into muscle. The more we strain and contract our muscles, the more those sutures may tear through the muscle, especially as the suture material is particularly stronger early and then progressively weakens and then breaks. So for the first 4 weeks, I actually recommend not doing any sort of exercise, including walking for exercise. That sounds extreme, but patients tend to get a little carried away. So avoid walking the block, avoid walking your dog, and don't get on a treadmill. After the 4 weeks, then we can start walking for exercise. A week later, we can start a light stationary bicycle without the arms. The week after that, you can advance to light dumbbells and stretch bands. So we're gonna start ranging our muscle and seeing how those sutures are pulling on the muscle or not. And finally, the week after that, we can start doing some more intense cardio and heavy lower body weightlifting. And then depending on the type of surgery that you had, you may have some long-term activity restrictions or you may not, and then you can advance as tolerated. Now, sexual activity. So this is kind of a sensitive topic, but it just mirrors the activity restrictions for exercise. If it's like walking, then you can do that around 4 or 5 weeks. If it's like Cirque du Soleil, you probably need at least 2 months. As far as scar care goes, typically what I recommend is using silicone-based scar tape that we usually start with patients somewhere between the 2nd to the 3rd, maybe even out to the 4th week. And I recommend doing taping for at least 2 months. You can certainly do longer, but 2 months is the minimum. If you found this helpful, check out our other videos. We have lots of helpful content as far as recovery and picking plastic surgeons and implants. Follow us on Instagram, check out our YouTube videos, and come see us at our office.